Hey everybody, it's Rachel. It's just a little bit before 7. So I said I would do this live yesterday and decided to put it up today. Yes, I haven't done one of these in about 3 weeks, almost 4 weeks. And so I thought this is about a good time to start updating you guys because things have gotten a little crazy here in Texas with coronavirus, as you guys have probably been seeing in the media. And I'm seeing a lot of confusion from folks that aren't in the medical world about what the numbers and everything actually mean that they're seeing coming out of these new hotspots. So for those that don't know, I am an emergency medicine physician or a doctor. So I work in the ER and I live in San Antonio. So we are now considered the #3 hotspot in the nation for coronavirus cases. And this happened quite rapidly. So last update I did was the end of May. And we were fairly flat here. We had less than 100 hospitalizations. It seemed like we were doing a really good job in the state of Texas, but specifically in San Antonio. And then our governor decided to open up everything quite rapidly. And even though we started getting more cases up, there was no slowing down of opening up, unfortunately. And so I went on a 2-week vacation at the beginning of June, and I watched while I was on vacation, the numbers just keep going up and up and up. I get a lot of internal. I am the medical director at my particular ER, and so I get a lot of internal data on hospitalizations and everything. So I knew this was getting bad while we were gone. Now, just FYI on everyone, I was not out and about in big public areas. We went kind of out in the middle of nowhere and hiked a bunch, and then came home every night. So we were socially isolating. I did post up a few pictures of that on my Instagram if anyone's interested. Yes, we didn't wear masks when we were out in the middle of nowhere because when you're not around anyone, you don't need to wear a mask out in the middle of nowhere. Okay. So let me talk a little bit about the data of what's going on here in San Antonio, since this is a hotspot in Texas in general, and then I'll go over a few other things at the end of this. If you guys have questions, just pop them in here. I'll try to read it as I'm going along here to update you guys. If you hear a lot of noise in the background, we're having like a pop-up shower storm, and my son is like screaming back in the other room on and off. So if that's real loud, I'm sorry. So in Texas, we went from the beginning of June at being about 3,000 cases in San Antonio. And now we're over almost 8,000 cases, I think, when my husband looked it up just right before I came into this video. When I left on my trip in the beginning of June, we had less than 100 cases in the hospital. We are now, the latest number is I think 622 in the city of San Antonio. Now that doesn't sound like a huge number, but if you think about that, that is in less than a 3-week period. We have gone from less than 100 to over 600. That's a 6-fold increase of cases. And those are the cases I'm most concerned about. When you get sick enough to end up in the hospital, that cannot be explained away by increased testing. And the reason I say that is we've always been able to test the sickest of the sickest who end up in the hospital. That has not changed. So now that I'm seeing large amounts, that's telling me there's uncontrolled community spread. And when they do the contact tracing, which we're not that great at still, they're seeing that most of this is community spread. So that's pretty scary. This is happening in Austin, which is I think number 4 or 5 as a hotspot. Houston, which you guys are probably seeing on the national spotlight. I trained in Houston. I have lots of friends that are ER, ICU, and other types of doctors in Houston. Their ICUs are full as of today, which is terrifying. If you don't know, the medical center in Houston is the largest medical center in the nation and the world. So when that city, which is the 4th largest city in the nation, runs out of hospital beds and ICU beds, that is terrifying. Now, part of those beds are being taken care or up by non-COVID patients, but now we need to start thinking about what we're going to do to deal with this increase of COVID, because it's going to keep going up. The line, and I posted this on my personal Facebook, but you guys can go and look on like Texas Web Dash, or Bexar County has one as well. The data went like this for hospitalizations and literally is like this now. And so I just don't see it ramping down again. We're just not there yet. And so we can't handle a continued 2, 3, 4 more weeks of this doubling. It will get as bad as New York if we keep up at this. And so that's a little scary. In San Antonio, we have about 25% of our beds left and ICU capacity before we are totally full. So the governor in Texas came out today and said, okay, we're not going to open anymore. We're going to stay where we are and not open any more businesses. That sounds really great, except for the fact that pretty much most businesses are open at a pretty high degree. So restaurants are open to 75% capacity. They opened up Six Flags last weekend on Father's Day weekend. I mean, come on, an amusement park. Bars are open up to 50% capacity. They know bars are part of the reason that this is out of control. So I don't know how helpful that's going to be. We're actually, as much as I don't think we can fully shut down again, we need to back off some of these places we know are a problem. Bars, big, large gatherings, things like that. So he also said elective surgeries are canceled. That's what the news media is saying. But actually, if you read the executive order, it gives the discretion to the hospitals to decide if they need to cancel elective surgeries in their hospital based on their capacity. So a lot of hospitals are basically like, we're fine. And they're going to push that to the limit because they lost so much money from the previous time when they had to shut down elective cases. So this is going to get bad, real bad. All right, so I had one question that someone was asking when I posted up on my personal page about death rates for COVID, and we're not seeing as high of a death rate. And yes, that is correct. So that's one bright, tiny piece of this, is that we're not seeing as high of a death rate. But if you guys will remember from Italy, from New York and all those, their hospitalizations steeply increased, and about 2 to 3 weeks after that is when they started seeing massive amounts of deaths. And so we are going to be at that point, So someone said that the CDC just announced pre-existing conditions, and should they still be considered a thing to be concerned about? Absolutely. So the pre-existing conditions that I'm most worried about when I see folks are anyone that's overweight. If you have a high BMI, anyone who has diabetes, those people do not do well. Obviously, lung issues, like we've had some 80s and 90-year-old folks that we've admitted with asthma, those folks don't do well. And then heart conditions seem to be there as well, because we see a lot of arrhythmias and clotting issues with this disorder. So yes, if you are, please if you're in one of these hot zone areas, please be very careful. My parents, for example, my dad has heart issues and some other autoimmune stuff. My parents have locked down again. They're not being around people because of that reason, because, it would be very detrimental to them. So, so death rates are lagging. We'll know in 2 to 3 weeks how bad this is really going to get in Houston here, Dallas, all that. Hopefully this is mutated a little bit so it's not as deadly. I just don't know. The other thing that may be skewing the death rates is now we're seeing a larger proportion of folks that are younger with this disease. But that also means we're seeing a larger proportion of these young folks in the hospital. Now, my particular hospital is in a very elderly section of the San Antonio area, so I'm still seeing extremely old folks, like 80s, 90s, even 100-year-olds getting COVID in my area, so they're not going to do well. Our main hospital that has been having a lot of COVID patients, they're seeing more of the 30s and 40-year-olds and some even 20-year-olds. So theoretically, those folks should do better, but that is still terrifying to know that 20, 30, and 40-year-olds are ending up in the hospital with this. So it's definitely kind of scary. One of the things also that is making potentially the death rate a little bit less bad this time is we do know some treatment modalities and things to do with this compared to when this outbroke in New York. For example, we know that chloroquine or hydroxychloroquine, Plaquenil, is not helpful. It actually can cause arrhythmias. We don't use that anymore. We know that remdesivir actually is helpful in some super sick folks, and we are using that in our patients, so that's helpful. We know that ECMO is very helpful, so we have I think last time I looked, it's either 8 or 9 folks on ECMO, so ECMO is really helping folks, preventing them from getting the complications from ventilators. We also know that putting people on ventilators early is harmful, and we try to stave it off as much as possible. So those things all could be attributing to the fact that this is slightly less deadly than it was when it first hit the U.S. We also had a new trial that came out literally like 3-4 days ago that shows a medicine called dexamethasone or Decadron. It's a steroid that's extremely cheap. It's helpful in those that are very ill, not in the early parts of the disease that can actually make it worse, but when you are requiring high loads of oxygen, that has shown to be helpful. That's a very cheap and easy medicine with not a huge amount of side effects, and so that's a great thing for treatment. So we do have some things that have really helped us progress through this. So those are kind of the main points I wanted to go over. So looking at this, the other thing that I thought was kind of interesting is there was speculation when this first came out that, oh, this virus will get better over the summer and warm climates. Obviously, it is exploding in the Sun Belt and the southern states. Part of that is because we're reopening. Part of that is because everybody's going to the beach. Obviously this shows that temperature does not play into this at all. Like, it's still spreading. We know that this seems to spread more in enclosed spaces, so they're noticing that this isn't spreading in any large groups and gatherings. There's a news media report going around about a family that got together and threw a surprise birthday party for one person. There were about 20 family members, and 18 of them have gotten positive. It just takes one asymptomatic super spreader to spread it about, and you can get your entire family sick. So reports have been saying, like in California, that it's spreading by house parties there, smaller parties of 20 to 40 people. In Texas, it's spreading because of people going to the beach because they're not, staying away from each other. In bars, because the bars are not maintaining the proper distance, which is not shocking to me. So if you're going to go do stuff, if you have to leave your house and go do stuff, try to avoid those situations. And if you're going to go where there are people, you have to wear a mask. There seems to be a politically, how do you say it? People are making masks political. Masks should not be political. And I truly and honestly and deeply feel this. There have been tons and tons of studies that show if everybody wears masks, it is one of the most effective things to decrease your chance of spreading this. And what I mean by this is we know that there is asymptomatic spread of this virus, that a couple of days before you show symptoms, you are the most likely to spread your virus from this. And so we know that is the time you feel fine and you're going to be spreading it, right? And so if you don't wear a mask, you're more likely to spread it. Now, is a average cloth mask going to protect you if everybody else is not wearing a mask? No, it's not. It's only going to decrease it a small amount, but it will prevent things like if someone sneezes, those droplets with the virus getting on you and then causing you to get it. So if everybody wears a mask, we'll do better. Right? Like it'll decrease it. There's this great meme going around that is pants. Pants are the thing. If everybody wears pants and you pee on yourself, you're not going to get it on your neighbor. If your neighbor is peeing and you don't have pants on, you're both going to get really wet. If you wear pants, you're going to get slightly wet. If you and your neighbor who's peeing both wear pants, neither one of you guys get wet, and it keeps it from going everywhere. It's a really crude way to make an analogy of it, but it is a great way of showing how well masks help. So even though most states are not mandating masks, or they're just saying, we want you to wear masks, you need to wear masks. So here in Texas, there's this whole freedom of you have your personal right to do things. The problem is your personal right should end when you affect those around you. So you don't have a personal right to spread your infectious disease to everyone else around you. So unfortunately, the governor here is not going to mandate people wear masks, but there's a loophole that all the people in the individual cities are using, and that is they can enforce on the businesses that they have to enforce mask wearing, which is kind of shady that they're making a business enforce it, but at least here in Texas, all the businesses are required to enforce that you wear a mask in their facility. Now, someone just a little minute ago asked about gyms and what I thought about them. I personally would stay clear of gyms. And the reason is that we know that enclosed spaces spread this further, right? And a gym is usually an enclosed space, unless you're going to go do something like CrossFit or that outside, which is a whole different thing. But when you're in an enclosed space, you're going to spread it more. And unless you think you're going to wear a mask in there, you're likely to spread it. And then when you heavy breathe, they found that these the virus particles spread farther. So if you're in a place where people are shouting and screaming and that kind of stuff, then that's going to spread it farther. So I'm just going to read this real quick. Yeah, someone was saying bars are where people go to socialize and consume some alcohol and get extra friendly. Absolutely. That's why I thought that was the stupidest thing for us to open up bars quicker, because you're opening up something where people lose their ability to reason properly. When you get alcohol in you, you lose your reason. You forget how close you are to people. You talk louder, you shout. So it's not uncommon that that would be a place where it will spread. So yeah, that's kind of how I feel about gyms and stuff. I think if you can, try to do your exercise either at your home or out and about, like go running outside. I think those are better outlets. Now, I haven't had anyone ask on this thing here, but I did mention it in like one of my other videos, the protests and the spiking and everything. I think this is an important point to put on. So we know with this disease state that it takes anywhere from 3 days to up to 2 weeks to get sick from your exposure, okay? And so we know that when we started spiking about a week and a half ago, 2 weeks ago, that actually was from our Memorial Day weekend. And if you go back and look at the news media, especially here in Texas, we had a couple of big bars in Houston and the beaches, and up in New Braunfels, just north of us, the river up there, we had a large amount of people that just went out and drank and like partied real hard and were tied in without masks. So what we're seeing right now is actually the spread for Memorial Day weekend. This week is probably going to be when we see if there's anything coming from the protests. Now we know that it's spread less out in the open, but there is this thing where if you get enough people together in a tight space in protests, theoretically you can spread it. Now, a lot of these protest people were wearing masks. What I do worry though is where people were sprayed with like tear gas or pepper spray, they rip off their masks, they start coughing, that's gonna spread it a lot more. And so those folks would have been they would have been asymptomatic period before they showed their disease state. So we'll see. Here in San Antonio, we didn't have a lot of protests here. I don't think protests are gonna cause much spiking, but I'm curious in Houston and other places that had much larger ones if they see anything. Someone said that in Minnesota they're not seeing a large spike. You'll really start seeing a spike this week if it starts happening. Now, the other thing is it's mostly young people. So if those young folks stay away from elderly family members, you're less likely to see them end up in the hospital. So it may not be as bad. So we'll see. I don't have the answer for that. But it's just, it is, yeah. I think we're gonna see some, but maybe not as bad. What made me concerned about the protests is that the populations that are getting devastated from this disease are the population that are out in those protests and that we're fighting for, right? The folks that are Black and Hispanic, the folks that are marginalized in our society that are already dealing with systemic racism and all that stuff, who have issues at access of healthcare and how they're treated in healthcare as it is. Those folks are the ones that are dying in higher numbers from this disease state. And if this ends up spreading like wildfire through those protests, that's going to be incredibly devastating. And that's what I, as a physician, just looked at. I was very afraid of, because that population is already at risk from this. We know that, if, for example, in here in Bexar County, we have, they break it down by race. And so whites make up about, I want to say it's like 40% of the cases or 30% of the cases, and we're about 20% of the deaths. Black population makes about 8% of the cases and make about 20 to 30% of the deaths. So you can see there's a disparity of race, and we don't understand why. So that's concerning. The same thing with the MIC miscellaneous C that you're hearing about children, that inflammatory process that's affecting young children. It's disproportionately affecting Hispanics and Blacks, and so we don't know why, and we don't know if it's what it is exactly. So that's something, as I kind of figure out and get more updates, I'll let you know. All right, trying to think if there's anything else. Yeah, so just a few more things. So where I'm at, we went from having no COVID admits in our hospital. Now I think we are up in the 40s, 30s or 40s. I'm gonna go to work tonight and I'll have a little better idea. I'm working the next like 5 nights in a row. But I can tell you now we went from kind of just wearing a regular surgical mask and only N95, that's that heavier duty mask, when we had an occasional patient that we were worried about. I am now wearing my N95 all day. My face physically hurts from that mask. I mean, I get red spots on my nose. I get marks all over my face. It hurts. And so, yeah, that's been painful. All the nurses are required to wear it. We just don't know what's going to walk through. Every day we're admitting many, many, many COVID patients. I'm sending many, many home. There are many, so your oxygen saturation should be 100, between 98 and 100%. If you are not dipping below 90%, we're sending you home, which is weird because I used to not send people home with oxygen saturations that low, but to preserve bed space. So know this, that's going to be, you might be sent home with a low oxygen saturation because of hospital capacity. So, all right. Someone said, let me see what they said here. Hold on. Dexamethasone didn't need hospitalization. Oh, that's awesome that she was taking dexamethasone. So someone was saying someone needed had been on dexamethasone and they didn't need hospitalization. So that's really, really good. Now, not to alarm folks, but the vast majority of people will do fine with this. We don't know the long-term sequelae or problems that you're going to get from this. We're still figuring that out. Some people have decreased lung capacity for a long time. But the vast majority of folks get this will either be asymptomatic or mildly symptomatic. It's just that percentage that are really bad. And why we care about it in healthcare, why we're freaking out about hospital beds is once we fill up and we have no ICU beds and the hospitals are at capacity, if you have a heart attack, if you have an asthma attack, if you have a ruptured appendicitis, guess what? There's no place to take care of you. That's why I worry. And I also worry because, for example, the major metros like Houston, San Antonio, Dallas, we take a lot of admissions from all the surrounding areas, all those hospitals that don't have ICUs down in the valley, down out west. We take all of those. And if we're full, we can't serve those communities. So that's something to be very aware of because you'll have higher mortality in things that shouldn't be, a problem like strokes and heart attacks and all of that. So that's why all the healthcare professionals are freaking out. So that's it, guys. I think that's all I've got for you. If you have any questions, leave them down below. I feel like I'm going to be updating mid next week just because I think this is going to keep raising exponentially, and I think that we are not even close to being peaked out of this at this point. So I think I'm going to have lots of updates for you guys. Let's see, how reliable are the results for the antibody tests? The antibody tests are not that reliable, just FYI. Unfortunately, the rapid ones that you can get, unfortunately, cross-react with other coronaviruses, so they may or may not tell you anything. Also, just if you're going to get coronavirus tested, the PCR is the gold standard. That's the one they swab you up the nose and all that stuff. So antibody testing doesn't tell us much. But yeah, questions, leave them down below. I'll read through them. I'll try to be a little more organized in this next video for you guys, and answer any questions you have, or I'll try to answer down below. But hopefully this will keep you guys safe. Please, please, please wear masks. Please stay home if you don't need to go places. If you do get stir crazy, go out away from people in the wilderness. Hug your loved ones because this is exploding all over the U.S., not just the Sun Belt, and so it's going to get a little hairy again. All right, guys, thank you so much, and I will talk to you guys later, okay?